moment. I'm just finishing up a prescription. My apologies. Yes, just pop yourself on that seat there. I will be right with you. Okay. Hi. How are you? Good. So overall, good. And the reason for your visit today? Yes. Let me see. Say they told reception you've been having headaches, insomnia, and a couple of concerns about your cognitive function. Okay. Seems like you've done the right thing by coming in today. I think we'll do a cranial nerve exam. This is an overall assessment. It's a general medical checkup, but it also focuses on your cognitive functionality, making sure that basic things like vision, sense of smell, muscles, all of those are working correctly and as they should be. It's a good sort of overall way of catching anything early or spotting any red flags that we might want to catch and explore more deeply. Good. I mean, it sounds complicated, cranial nerve, but it's a very simple test. There's no right or wrong answers, of course. Hopefully we should be able to get to the bottom of whatever it is that ails you. Okay? And to be fair, when it comes to things like headaches and some lacking cognitive functions that are usually there, it more often than not boils down to lack of sleep or stress. Stress is such a big causation and factor in so many cases that we treat. Obviously, not everybody has the means to mitigate stress, but we'll give you some advice and, if necessary, some medication to recenter yourself and focus. But first off, we're going to take your temperature. Just going to check your vitals. Alright. Change these gloves. Fresh pen. Okay. I just have a thermometer here. This is just a little device that's going to go under your tongue and tell me what temperature you are. Okay? If you could just open your mouth like this. Lift up your tongue. And I'm just going to pop this here. Try to just relax and breathe normally. Okay, yes. Absolutely fine. 36.4, which is bang on perfect. Just going to check your heart rate now. I'm going to do it by feeling under your neck for a pulse, okay? Actually, this is the old-fashioned way, but the old-fashioned ways are the best. So, just going to place my hand here. Ready? And try to just breathe and relax. If you're slightly stressed, it can give a false reading or an elevated heart rate. And very good. 2, 3. Yeah, that's fantastic. resting heart rate of 68. Just going to double check that one on your wrists. Okay, just this area here. Any preference on wrist? Okay. Ready? Just going to hold this here, and again. Okay, that one's about 70. So between 68 and 70 is very healthy. Yeah. Let's listen to your breathing. Can't see on your chart that you have any lung or breathing issues. No. Have you had COVID-19 within the past 6 months? You haven't had it at all. Okay, that's good. Right, sometimes it can affect the breathing. All right, so I'm going to try and do this as invasively as I can. It's just going to go down this bit at the top, okay? So if you could just undo the top button there. All right, try and warm this up. Okay, and just popping this here. Okay, if you could just 3 seconds on the inhale, hold it for 1 to 2 seconds, and then 3 to 4 seconds on the exhale. 1, 2. Very good. Over here. And hold it. Exhale, very good. And let's go down here, same again. Okay, that sounds clear. Let's just come on the back side now. Alright, okay, so same again, big deep breath in, and then hold it, and then exhale. Okay, this next time I'd like you to just give a little cough once you've inhaled, so, and now just a little like you're clearing your throat. Okay, down here, same again, and then one more time. Okay. Breathing sounds good. No obstructions, which is fantastic. Pulse in here. Okay. Alright, let's move on to the cranial nerve exam portion. So we're going to start with your olfactory nerve. This is your sense of smell, okay? Now I've got some scented bottles here on the side. And these are all normal, easy to guess household smells, if you will. Just going to ask you to cover one nose, inhale, and then let me know what this scent is, okay? Have an average sense of smell? You haven't had any injuries or infections that have affected your sense of smell or taste? No, okay. Oh, you're lucky. Some patients can't smell or taste anything. It's very sad. Okay, first bottle. I don't think it says what it is, but try to avoid looking at the bottle if you can. I'm sure some of them have the scents marked on them. Ready? Big deep breath in and your best guess as to the smell. Rather easy one, that is orange. One of my favourite fruits. Okie doke. Okay. Big deep breath in again. This one's a little harder. Well guessed, that is chamomile. A soothing fragrance. No. This is the third bottle. Okay. Let's switch sides to your other nostril if we could. Alrighty, ready? Okay, here we go. Yes, easy. Mint or peppermint. Last one. Deep breath and your best guess. Of course, that is strawberry. Beautiful citrusy smells. Olfactory nerve seems absolutely fine. Good, good, good. Tick, 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 tick. Alright, let's check your visual fields. Alright, so I've got a small paddle here. You can use this to cover one of your eyes. Then I'm going to ask you to stare directly sort of the center of my face, okay? It doesn't really matter where, as long as you're not looking at my hand, which is going to be in your peripheral vision. Now, I'd just like you to tell me when you see my fingers wiggle, okay? So, start by covering this eye. Just looking here. Just let me know when you see my finger wiggle. Good. 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 No peeking. Good. Alright, let's switch sides. So, it's covering this eye. Let me know when you see my finger wiggle. Good, fantastic. Very good. Okay, let's check the visual acuity. For this, I need the Snellen chart. This is a small handheld version of the one on the wall over there. Okay, so I'm going to cover one of your eyes again and then instruct you to read the lines. And we're going to get progressively harder, okay? So we'll start here. And just again, covering this eye, read the top line. Good, and the one beneath. Yep, and the one beneath that. Very good, moving to the one beneath that. And can we try the one beneath? Struggling a little bit now, okay, well. Just one last try of the one beneath that. Okay. Yeah. Reasonable. Doing the same on the other side now. I'm going to cover this eye. Can you see the chart? Okay, let's start on the top line. Moving to the line beneath. Yep, and the next line. And the one beneath that. And the one beneath that. And finally, the one beneath that. Okay, using both eyes, I'm going to point to random letters and I want you to tell me, or give your best guess as to what they are, okay? Ready? Yep. Yep. Yes. Okay. Okay. And here. And here. And this one. Okay. A valiant effort. So here you wear glasses, so particularly well done for doing that without. Alright, so okay. Let's do your ocular motility. Okay. Alright, just looking here. Keeping your head still and covering this eye. Can you see the light? Alright, again, head still and just tracking with your eye wherever the light goes, okay? So, good. We always start by using a H pattern to check through the different quadrants of your vision and then move to the diagonal in an X motion. Good. Alright, now cover the opposite eye. Looking here. Can you see the light? Alright, now without moving your head, following the light wherever it goes. Fantastic, you're doing very, very well. Okay, good. Ocular motility seems to be perfect. Alright, so ocular motility. Alright, let's have a look in the back of your eyes now. My apologies, I'm going to need to come rather close to you, but it's all in the interest of finding out the back of your eyes are working as they should be, okay? So if you could just pick a spot either behind me or staring at my ear. Okay, if you could look straight ahead, directing your gaze upwards, look to the left, and look to the right. Look down. And back to the center. Okay, If you could look up and left. If you could look up and right. Down and left. Down and right. Okay. Let's move over to this side. So. Finding the vein, following the vein down, and looking straight ahead. Looking up, down, to the left, to the right, back to me, up and left. Up and right, down and left, down and right, back to the center. Okay, good. Just gonna write that down. Everything is good. This is a pupillary light reflex. Alright. If you could focus on an item behind me, either the jellyfish lamp or the skull or the model of the foot skeleton. So, take your pick. Okay, just staring at that spot. I'm going to check the direct response of your eyes to light. Direct response. Yes, both eyes seem to be responding. Okay, and the consensual response looks perfect. Okay, good. Covering this side. If you could just look at the wall chart. Okay. Direct response looks to be accurate. And the consensual response looks good too. Alright. I'd like you to focus on the paddle, and when I say switch your focus to the light. Okay? So, paddle, light, paddle, light, paddle, light, light, paddle. Very good. Paddle, light. Keep looking at the light. Okay, good. Same thing again. Paddle, light, paddle, and the light. Paddle, light. Look at the paddle and to the light. Good. Let's pop this here. Okay, good. Eyesight. Fantastic. No issues with the eyes. Let's do the trigeminal nerve. Use the tongue depressor for this one. Okay, so I have a wooden stick here, otherwise known as a tongue depressor. I also have a metal tuning fork here. What I'm going to do is ask you to close your eyes. Then I'm going to press at various different points all over your face. And obviously the wood is room temperature and the metal will feel colder. So I just want you to tell me if it's the hot, we'll call this hot, or cold. Okay, this is your sensory perception of temperature, obviously. Ready? Okay, eyes closed. Is this hot or cold? 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 Good. A similar test. I'm gonna retract my pen so it's sharper than this end but not sharp. So I'm gonna press at various points over your face with the blunt side or the sharp side. I just need you to tell me if it's sharp or blunt, okay? This is testing your touch perception. Ready? And eyes closed. Sharp or blunt? 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 Very good. I must say, so far so good. Okay. Just going to press at various points over your face. I want you to tell me if you feel it the same on both sides, okay? Does this feel the same as this? How about this or this? And this or this? This or this? Feel the same? Okay. Does this feel the same as this? Does this feel the same as this? And lastly, does this feel the same as this? Good. Well done. You are doing fantastic, very good. The next thing I'm going to do is I'm just going to touch areas of your face and check your facial muscles. So for this, I need to change gloves, okay? Alright, so I'm just going to be checking over your face and scalp, okay? Okay, just going to lightly press over some areas. Pop your head down. Okay. Any tenderness here? What about over here? Okay. And when I press here, any tenderness? Okay, here. Okay, so when you experience these headaches, what would you say is the sort of concentrated source of the pain? Is it the center of your head? Is it sort of towards the temple region? Is it at the back or top? Okay, so you'd say it's kind of along here and behind your eyes almost, yeah. That makes sense. Almost sounds like a tension headache. And is it worse in the mornings or later at night? What about during the day? Okay. And your job, is it particularly demanding? Alright, okay. So you work long hours, yeah. It's a pretty normal thing to see, to be honest. Okay. Okay, just close your eyes for me. Just gonna press on the lids. Press here on the lid. Just gonna press on this lid. And this region here. Okay. Alright. If you could scrunch your eyes together, I'm gonna gently try and pry them open. Just don't allow me to. Resist, 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 resist. Good. Resist, resist, resist. Good, okay. Now if you could open them wide and don't let me shut them. Okay. If you could just scrunch your nose up. Okay. And now if you could clench your jaw. Okay, I'm just going to feel around here. If you could take a large gulp. Once more. Okay. Just open your mouth and say, oh. And again, oh. Okay. Check here. If you could suck in your cheeks. Now blow them out. Okay, now if you could turn your head this way, I'm gonna push that way. Just like you to resist if you could. So turn your head. And now resist, 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 resist. Okay, and now this way. Resist. Good. Like you just shrug your shoulders like this and don't let me push them back down, okay? Alright. Okay, good. I'd like you to push your head forward like this. I'm just going to lightly press on your forehead and try and push you back. I'd like you to again resist, okay? Okay, resist. Okay. Now I'm going to put my hand behind the back of your head. I'll let you to push your head back like this and don't let me push it forwards, okay? Resist. Good, okay. Raise your eyebrows. Frown. Okay. If you could raise one arm up to the side and don't let me push it back down, okay? Resist. And over this side, raise this arm out. Don't let me push it back down. Okay. If you could just get your hands like this and split your fingers. I'm going to push them from the outside. Again, resist. Sure you're understanding the theme here. Okay, now I'm going to try and push them out. I'd like you to keep them nice and taut together. Okay. Now I'd like you to raise your arms out in front of you and don't let me push them down, okay? Okay, good. Any tenderness at the back of your neck? Okay, and in the lower back region and just behind your shoulders. Any pain? Okay. If you get your arm like this, I'd like you to, keeping this bit completely straight, only move from your shoulder, sorry, not your shoulder, your elbow, to your fingers. I'd just like you to rotate it back like that, okay? I am going to push against it lightly and I want you to resist, okay? Okay, good. Same again, shoulder to elbow completely straight and then push backwards. Okay, good. Alrighty, that seems to be fine muscle. Let's try reflex origin. I'm just gonna very gently knock on a couple of points over your body. This is going to trigger a little reaction, call this a reflex. This one behind your ear, so I'm going to start with this one. And this one. Good. And now, this one just back here. Yep. And there. Good. And now I'm just going to do the one on your elbow. Don't worry, I won't do it hard. Good. Over here. Good. The most famous one that everybody knows, the knees. Ready? Good. Good. And again. Good. There's actually one at the back of your legs, behind your knees, that not a lot of people, not as many people know about. Ready? Perfect. Perfect. Okay, now just sitting back in the chair, I'm going to hold your foot. I'm just going to knock the back side. Ready? Good. Over here. Good. And the front. And the front. Good. First one. Strawberry. Well done. Very good. Next one. There we go. What do we think that is? Mint, yes. It smells like toothpaste to me. Let's try a little bit harder this one, but if you're into cooking, you should know this one. Yes. Rosemary. Well done. Okay, last bottle. Ready? Here we are. Good. That's garlic. Okay, well done. Moving on to your optic nerve. First, we're going to check your visual fields, okay? This is a very simple test. Now, firstly, I'd like you to cover this eye, okay? Keep your vision straight ahead. Now, I'm going to hold up my gloves, and I want you to tell me which side is wiggling. I'm going to wiggle my fingers, okay? So, this eye closed, looking straight ahead, and try not to look at the gloves, okay? Very good. Ready? Good. Doing very well. Here we're just moving into the different quadrants of your vision. This will show us if there's any issues with your peripheral vision, and also if there are issues, which quadrant they're in. But so far, so good. Okay, now just cover the other eye. Same thing again, just looking straight ahead. Ready? Okay. Good. Good. Doing very well. Lastly here. Good, well done. Doing very well so far. That's your visual fields covered, and now your visual acuity, okay? So, this involves a little eye chart. So, again, we're going to start by covering this eye, and it's the lowest line that you can read. Okay, I'm just going to point at letters, and I want you to tell me what they are, okay? Good. Let me try down here. And here. And can you read this line? Yeah. Good. 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 Can we move it a little bit further back? Can we try this line? Okay. Here, here. Yeah. Very good. Alrighty, now we're just going to cover this eye. Same thing again. Start with a nice easy one at the top. Yeah, C. D. C. Oh, well then. We'll try this line. Yeah. Good. A little bit further back. Can we do this line? Okay. Good. Looking good so far. Colour test fine. Ocular motor nerve. This is a very fancy word for your movement in your eyes, okay? So, focus either here, just keeping your head straight. Now, it's important you keep your head still in this, don't move your head from side to side. I'm just going to hold my finger here, and I'm again going to move it into the different quadrants, and I just want you to follow it with your eyes, okay? So, looking straight ahead at my finger. Good. Tracking in your eyes appears to be just fine. Right, let's cover this eye. And just follow my finger. Doing very well. Good, and now the other eye. Focusing on my finger. And now with both eyes uncovered, just focus on my finger. And they converge nicely, well done. And again. Convergence, there we go, lovely. See, it's not so difficult. Okay, let's check your extraocular movements. Another fancy word for movements of your eye. This time I'm just going to check with a light, okay? So, hopefully it's not too bright, just looking straight ahead. Just going to move a little bit closer, okay? Okay, if you could look up, look to your left, look to your right, look down, and now back to the middle, up and left, very good, up and right, down and left, down and right, well done. Now again, I'm just going to come look at this eye. Again, I need to come quite close to you, I apologise. It should be over quite quickly. Alright, just looking directly forwards. Just looking here at my ear. Looking up. Looking over to your left. Over to your right. Looking down. Back to my ear. Up and left. Up and right. Down left. Down right. Back to the middle. Well done. Extraocular movements just fine. Pupillary light reflexes next. Again, I'm going to use my light for this. Okay, so just pick a point on the back wall. Stare off into the distance if you would. I'm going to bring my light in from the side, okay? I'm just checking to see if your eyes constrict and dilate as they should. Very good. And both eyes appear to be working in unison, even the one the light is not shining into, which is perfect. Keep just looking at that back wall. Alright, I'm going to try the other side now. Just pick a point. You can look at the chart, you can look at the window, somewhere in that general direction. Good. Direct response looks great, and so does the indirect response. Good. Pupillary light reflex looks perfect. Okay, trigeminal nerve. Another fancy word. This just means your facial muscles and, most importantly, facial sensation. So, got a cotton pad here. It's very light. I'm just going to press at various points over your face, and I just want you to tell me if you feel it, and then if you feel it equally on both sides, okay? So, good. 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 Over here, over here, over here. Does that feel the same on both sides? Yep. And up here. Does that feel equal on both sides? Good. Down here. Does that feel equal on both sides? So on your nose. Good. Okay, same thing, but this time I've got the top of the tuning fork. It's quite cold. I'm just trying to see if you can perceive temperature properly, okay? So same again. I'm going to touch at various points, and you just let me know if it feels the same on both sides, okay? So just here. Does that feel the same as that? Good. And down here, does that feel the same as that? Up here, does that feel the same as that? Very good. One more time. Does this feel the same as this? Okay. Next, if you could just close your eyes for this one. I'm going to touch with either or. And I just want you to tell me which one it is. Should be quite easy, okay? Ready? Yep. Yep. Mm-hmm. 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 Good. Very good. That's brilliant. Just quickly want to check the reflex in your jaw. Just going to press here and hit gently, very gently, with this small hammer, okay? Pressing here. There we go. One more time. Perfect. Okay. Trigeminal. Okay. Lastly, on your facial muscles, I'm just going to check a couple of them. Okay. Ready for some instructions. So, puff out your cheeks. Suck them in. Clench your jaw. Good. Now, try and open your jaw. I'm going to push against it. Good. Raise your eyebrows like this. I'm going to try and push them down. Okay, good. Now, keep your eyes open. Don't let me close them. Don't let me close them. Don't let me close them. Don't let me... Good. Okay, now shut your eyes and don't let me open them. Good. Say ah. Can you move your tongue from side to side in your mouth? Yep. And once again, clench your jaw together. Good. Perfect. All looks good there. Now for your vestibulocochlear nerve, which is another fancy word for your hearing, okay? For this, I'm just going to move a bit closer again. I'm going to have my gloves up next to your ears, okay? And I'm going to rustle them, and you just need to tell me if it's on the right or the left side, okay? Should be fairly easy. Ready? That was both, yeah, to start off with. Good. 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 Now I'm just going to whisper some medical words into your ear. I just want you to repeat them back to me, okay? Eyes closed. Good. Ocular motility. Orbital bone. Trigeminal nerve. Well done. Over here. Nuclei. Cranium. Heart palpitation. Blood pressure. BPM. Very good. Hearing seems fine. Good. Moving on. Lastly, I just want to check some of the muscles in your neck, in your shoulders, and in your hands, okay? So if you could just turn your head to this side, I'm going to gently try and pull it back to me, just don't let me. Good, and now the same on this side. Good, now raise your shoulders like this and don't let me push them down. Don't let me push them, don't let me push them, don't let me push them. Good. Now if you can just raise your arms in front of you, I'm going to push them down, don't let me. Good, and now the same, but I'm going to push up and you're going to push down against me. Ready? Good. Now raise them out to the side, don't let me push them down. Good. Now with your fingers, push them apart like this. I'm going to try and push them back together, don't let me. This hand first. Good. Now over here. Good. Very, very good. Now just push against my hand. Push. Push, 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 push. Good. Once again on this side. Very, very good. Now just lastly, just going to check a couple points on your body that should react with a reflex, okay? Over here. Good. And again. Good. Over this side. Good. Good. Now your knees. Good. And here. Good. And lastly, your feet, just the back of your feet. Ready? And again over here. Good, well done. You've done very well. Hi, good evening. Come in. How are you tonight? Lovely. Well, please just take a seat. My name is Dr. Matthews, and I'm going to be conducting your exam today, okay? Now, it's a full-body physical checkup. Essentially, it's a general overview of your health, a kind of snapshot of where you're at with things. We do have some questions to get through first, if you don't mind, but we'll get through them quickly, okay? Okay, lovely. Could you just confirm your date of birth? And the year? Lovely. And your full address, please. Alright, and do you have an idea of the rough date of your last checkup? Okay, that would be the 7th. It's okay if it's not specific. Yeah. Lovely. And your national insurance number? Alright, any issues of heart issues in your family? Anything like that in your family history? And alright, whose side was that on? Okay. And have you had a new or sort of continuous cough recently? No? Okay, good. We have to ask that one. Right, okay. So, are you worried about a possible chest infection? What's caused that worry? Okay, yeah. And just sort of a tight feeling. Right, okay. Well, I'll tell you what, when I check over your lungs and your breathing later, I'll have a more thorough look of that area, okay? Good, alright. Okay, let's do your height and weight first, alright? Just pop this to one side and... yeah, we'll do it the old-fashioned way with the tape measure. If you could just stand up as tall as you can, please. Alright, just stay there, that's good. Okay. Alright. Yeah, sadly we get to a point where we stop growing. Yeah, of course. Now let's check your weight. I apologize, nobody likes having their weight checked. If you could just take a step forward and stand on the square there. Okay. And I'm just gonna move this dial slightly further over. Alright, that's about the same as it was last time, to be honest. That's good. You're at a very healthy height and weight. By which I mean you're at a healthy height for your weight. It's been a long day. Alright. I'm gonna check your heart rate, but I'm gonna do it with the stethoscope, okay? this over here. Good. Okay. So I'm just going to listen to your heart first, and I'm going to count the beats, which should give me a rough idea of the BPM. Alright. Alright, if you could just undo that button. Okay, just gonna pop this here and count. It's a rough average, of course, yeah. But resting heart rate is pretty healthy. Okay. Now, so you said you were having a little bit of an issue with the tight feeling in your lungs, a little bit of congestion, any kind of cough or anything like that. Interesting. Alright, well, I'll have a listen and see if I can hear anything. It might be a sign of an infection, or it could just be anything, to be honest. We'll get to the bottom of it. Alright. Okay, if you could just undo the other button. I need to get a little lower this time. Alright, I'm just gonna put this here in various places and give you some instructions, okay? Alright, if you could just start a continuous breathing pattern of about 4 seconds. Inhale. Hold it for 3. And then exhale for another 4. 1, 2, 3, 4. Good. 1, 2, 3. It's very good. And down here. 2, 3. And then. Very good. Okay, this time I really want you to suck all the air into your lungs. As big and deep a breath as you can, okay? Yeah, there is a little bit of congestion there. Just a tiny bit. Okay, this time if you could just hold it. And release. Good. Okay. I'm just gonna get you to cough for me, okay? Just a big cough. Alright, and again here. Once more of it. Okay. If you could just allow me just to get around the back, okay? It doesn't sound like there's an infection there. There would be more sort of phlegm sounding. It sounds almost dry. Alright, one more. Okay, keeping that 1, 2, 3, 4 rhythm going. Good. Over here. Very good. Okay, this time I would like you to hold it. Big inhale and just hold it there. Okay, is infected. So. Alright. I'm just going to check over the muscles on your face, and I'm going to touch you at some various points, okay? Nothing to worry about. I just want you to give me some feedback on if there's any soreness there, okay? So just pop your head down for me. Alright. I'm just going to tap around here. And any soreness. Just close your eyes. And over this bit. Oh, good. Just turn your head to the side slightly, that's good. Just checking your glands here. If you could just go. And again. Alright, let's check over this side. Yeah, just about here. If you could just gulp again. Alright. I'd like to check a few more things before I come to any kind of conclusion, okay? It seems mostly fine, to be honest. There's a couple of signs of maybe inflammation or possible infection, but if it is infected, it's not very far along, so it may well clear up on its own. I'm not entirely sure antibiotics would be the best course of action, but we'll see, okay? We shall see. Alright, let's see. I'm just gonna have a little look in your ears, okay? It's gonna move a little closer. If you could just turn your head that way. Okay. Let's start by popping this. And this side of your ear. Just having a brief look in your ear canal, which appears to be quite clear. Just keep your head that way. Thank you. You're doing great. That's fantastic. Okay. Good. If you could just turn your head that way now. Alright, over to that side. Good. I'm just gonna pop this in here. I mean, that doesn't appear to be congested either, which is very, very good. Okay. Alright, I'm gonna take a quick temperature reading, okay? Again, inside of your ear. Okay, just looking straight ahead. There we go, just popping this in here. Good. It should only take a minute. I'd say that's a little on the high side. Are you experiencing any sort of loss of high frequencies in hearing, or struggling to understand people when they speak, kind of thing? So some loss of higher frequency. In that case, I think I'll just do a brief hearing check then, alright? Okay. Alright. If you could close your eyes, I'm basically going to move around to the side and I'm going to whisper some numbers to you, okay? I just want you to repeat them back to me. Okay. Eyes closed. No cheating. Alright. Ready? 21. 18. 17. 4. 3. 7. 2. 9. 15. 17. 4. 3. 9. 8. No issues there. Alright, let's try the same on the other side, okay? 4. 17. 2. 9. 7. 100. 13. 4. 9. 17. 70. 6. 8. 4. Good, alright. Still keeping with the hearing exam, I'm gonna hold up my hands and make some little rustling sounds next to either ear, okay? I'd just like you to tell me if it's the left or the right ear, okay? Alright, I'm just gonna come here. Okay, ready? Good. 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 Getting further upon now. Good. 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 And then close up. Good. 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 Well, that seems reasonably normal, to be honest. Okay. Okay, so I'm just gonna put a little bit of eye drops in your eye now, okay? It's just to help them dilate and help me see what's going on a little bit better, but it shouldn't be uncomfortable, alright? Just pop this here. Okay, if you could just open your eyes and look up slightly, okay? Just got a little plunger here. It's just gonna go pip, 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 okay? It's really nothing to worry about, ready? And one there. Good. Blink. Alright, let's do the other side. And just keeping those eyes nice and open. There we go. See, it's really not that bad. A lot of people stress out about that part, but it's yeah, it's okay. Okay, that should just take a couple of seconds to work. same down here? Okay, good. Very good. And same up here. Back again. Very, very good. Alright, same on the other side. So now you're going to cover this eye. Alright. Ready? So looking straight ahead, not following my hand. Just using your peripheral vision. So let me know when it disappears. Good, and reappears. Good. And down here. That's very, very good. And reappears. Good, and disappears. And reappears. Very, very good. Doing very, very well. Alright, similar test, but if you can start by covering this eye, good. I'm going to hold up my hands and I'm going to hold up 2 fingers like this. And one side is going to wiggle, and I just let you let me know which side it is, but I'd like you to keep your vision straight ahead, so try not to look at the individual hands. Okay. Okay. Just say left or right. Good. Yeah. Good. Very good. 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 I'm just going to move back a little bit. And move my hands outwards a little bit as well, okay? Good. Just say left or right. Very good. Very good. Great. Now if you could just switch to covering this eye. Fantastic. Again, keeping your vision straight ahead and not looking at the individual hands, alright? Very good, right? We'll start nice and easy. Very good. Peripheral looks fine. Just blink a couple of times. Alrighty, very similar test, but this time I'd like you to identify how many fingers I'm holding up, okay? Just putting them there. We'll start by covering the eye on this side, okay? Now, similarly, I'll be holding my hands up, but this time I'm going to hold up fingers. So 3, 5, 1, 2, exactly. You get the idea. Just looking here. So, just repeat them back to me. Good. Very, very good. Very, very good. looking straight ahead. Just looking here. Keeping it very still, but just following the light with your eyes. Okay. That's all great, thank you. Very quickly. There's here. Okay, if you could just really fill your lungs to their full capacity. Big deep breath in. Hold it. Let it out. That's very good. And again. Big deep breath in. Hold it. Let it out. That's very good. Same again down here. If you could just take a really big deep breath in. Hold it. Very good. Okay, finally. This time when you're taking your breath in, I just want you to get a little cough. Just to, okay? As if you're just clearing your throat. Very good. Cough. Good, okay. Alright, I'm going to do the same, but this time I'm going to come out the back. Alright, same again. Slow, deep breaths in. And exhale, that's good. Same again. And exhale, very good. Just lastly, we're going to do the same down here. And exhale. And lastly, I'd just like you to cough, okay? So, and a little cough. Good, okay. Anyway, any obstructions? Your breathing sounds fantastic. Oh, that rain is really picking up. Okay, I'm just going to check the muscles on your face and on your scalp, okay? It says that you've got a latex allergy, so have very clean hands. I'm not going to use gloves today, if that's okay. Alright, so if you could just pop your head forward with me. Good. If you feel any discomfort at any point or any tenderness, just let me know. That's very good. Okay, I'm just going to lightly tap around these areas on your face. So when you let me know how they feel. Does the right side feel equal to the left side? Good, okay, I'm going to check your brows now. If you could just raise your brows up. Good. Now I'm going to do what's called palpating the orbital rim, which is just a very posh way of saying I'm going to touch around this bit of your face, okay? Any pain, soreness, tenderness? That's That's great. Just blink for me. Just going to raise up your brows now. Good. Just going to feel around your jaw as well. You could just clench your jaw as hard as you can. And just open your mouth. Just going to use a tongue depressor just to check the back of your throat. I apologise if it's a little bit uncomfortable, but open up. Say ah. Not had tonsillitis in the past few months, have you? No, no inflammation there. Good. Just scrunch up your nose like this, like a rabbit. Very good. Just close your eyes shut really tight and don't open them. Good. Alrighty, we're going to have a little look in your eyes now, okay? Just going to use this little device here, it's called an ophthalmoscope. Allows me just to see in the back of your eyes, okay? So I need to come quite close to you, but it'll be over very quickly. Just going to give you some basic instructions, okay? This just helps me adjust the focus to see you properly. Good, okay. If you could just look up. And if you could just look down. Over to your left. And the right. Good. Now back to the center. And just focus on my ear here. Good. We're going to check the other eye now, okay? It's going to switch. Okay. Just start by focusing on my ear here. Okay, and look up. And down to the left, over to your right, back to the center. Okay, I'm just going to pull your lid up slightly. Okay, that's good. Blink. And blink again. Now look to the back wall. Very good. Okay. Doing great. We're getting through this fast, aren't we? Feel okay? Good. Alrighty. Okay, so I'm now going to just check the consensual and direct response of your eyes and your pupil, okay? This is a posh way of saying, making sure that this eye does the same thing as this eye, okay? So I need you to place your hand in the middle of your face to divide between the two eyes. Okay. Now I'm just going to swing the light very gently into your eye. I'm checking to see if the consensual response is the same in both pupils, which it is. Very good. Okay, now I'm just going to do the same on the other side, so keep looking straight ahead. I'm just going to swing the flashlight gently into your eyes and check the results are the same on both, which they are. Good, very good. Feel free to blink. Alrighty, if you could just cover one of your eyes, either or. Great. Now, I'm going to have you keep your head very still, and I just want you to follow the light with your eyes, okay? I'm just going to check your tracking now, okay? So, focusing on the light, not moving your head. Just following it up and down. Checking the 4 quadrants of your vision here, which you're doing very well. Tracking seems perfect. If you could just switch to the other eye. Okay, again looking at the flashlight. And just following it wherever it goes without moving your head. You're doing very well. Fantastic, well done. Feeling okay? Good. Okay. Eye tracking. Okay, 6, good. A couple more on your eyes before we move on. Okay. I've got a paddle here. I'm going to cover your eye, or bring it quite close to it, and then I'm going to ask you to focus on my finger here, and then move back to focusing on the paddle. So I'm just checking that your eyes can focus at distance and close up, okay? So I'm going to start here, focus on my finger, and the light, and my finger, back to the light, and over here, over here. Just looking at the paddle and my finger. Good. Switch now, so if you can focus here on my finger, now the paddle, switch to my finger, and the paddle, and switch to my finger, and the paddle. Good, okay. Now, keeping this eye covered, I'm going to start with the paddle here, and I want you to just look straight ahead. You can look at my face or the wall, and I'm going to move it slowly out of your vision range. Now, around here, you should have a blind spot. We've all got a natural blind spot. I just want to see what yours is, okay? So, looking straight ahead, not looking at the paddle. I just want you to tell me when it disappears out of your vision, okay? Okay, and let me know when it reappears. Good, we're going to do one for all 4 quadrants, so looking straight ahead. Letting me know when it disappears and reappears. Very good, and we'll do the same over here. Very good. Okay, let's switch eyes. Just letting me know when it disappears. And reappears. Very good. Good. Very, very good. A couple of bits of sensation on your face, okay? So, here I've got a brush. Obviously there's a soft end and a hard end. I'm going to ask you to close your eyes, and then I'm going to touch you at various points over your face, okay? And I just want you to tell me if it's the soft side or the hard side, okay? Alright, so eyes closed. Yep. Yep. Mm-hmm. Mm-hmm. Just on here. And over here. And here. And here. And here. Good. That's very good. Just keep going. Good. Very, very good. And similarly now, I'm going to touch you on both sides of your face with the soft side. I want you to tell me if the sensation feels equal in both, okay? So, the same on both sides, right? About the same? Okay. About the same? Good. Good. Try your temples now. About the same? One more time. Good. Okay, now I'm just going to check some of your reflexes, okay? So, at various points of your body are little hotspots where we can tap, and they should cause a reaction, natural reaction, right? It just checks that everything's working properly with your body, your muscles, your connection from your brain to your muscles, okay? Alright, just going to start here. Good. And here. Good. There's one behind here. Good. One over here. Good. If you could just stretch your arms out. Good. 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 There's some behind your knees. Good. And here. Good. Just going to check the sensation on both sides now, okay? I'm just going to tap you on either shoulder, either arm, various points of your body, and you just tell me if they feel the same on both sides, okay? Right, so. About the same? Good. And does this feel the same as this? Good. Does this feel the same as this? And this? And this. Good. One more time. Good. Very, very good. How are we feeling? Doing fantastic so far. You're extremely healthy. No cause for concern anywhere. Alright, I'm just going to have a little look in your ears now, okay? Nothing too extensive, don't worry. Just need to make sure this is on the right setting. Good, alright. just going to come on the side and just have a little look, make sure there's no debris. Good, looks like your ear is very clean. How is your hearing? Good. Let's check this side. Good, alright, now just going to make some little rustling sounds either side. I'd like you to close your eyes and then just say left or right, okay? Alright, ready? Good. 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 Very good. 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 Very, very good. Basic hearing test, fine. Nearly done. Okay, I'm just finally going to check your muscles, okay? Nothing too crazy, don't worry. I'm not going to ask you to lift any weights, but I'm going to ask you to push against me and cause a little bit of resistance, alright? So, first thing I'd like you to do is shrug your shoulders up, and I'm going to push down on them. Just don't let me, okay? So, shrug them up, very good. Good, okay. Now if you could raise your arms out, I'm going to try and push them down, so don't let me, okay? Ready? Good. Now same thing, you're going to pull them down, now I'm going to try and push them out, okay? Very good, very good, very good, very good. Very good. Same with your legs. If you could push them out, I'm going to try and pull them back, okay? Good, and over here. Very, very good. And lastly with your feet, just like push them down like this. I'm going to try and push back. Good, over here. Good, and same with your hands. I'm going to try and pull them back, just push them forwards, okay? Over here. Over here. Good. As far as I can tell, your vitals are perfect, your eyesight is absolutely on point, your muscles and tendons are all working exactly as I would expect, your height, weight, BPM, all that stuff. I'm very healthy, to be honest. Good, very good. It's a cranial nerve exam, it's very, very easy. We'll try and get through it as quickly as we can, okay? I won't take up any more of your time than needs be. Okay, olfactory nerve, this is your sense of smell. Got some bottles here. Just gonna put them under your nose and you just tell me what the smell is, okay? Very, very easy smells. Very good, that's vanilla. Next one. Good, that's strawberry. And again. Yep, that's mint or toothpaste. And lastly, this one. That's garlic. Good. Olfactory nerve looks A-okay. Now your optic nerve, visual field. Okay, so just looking straight ahead and covering this eye, I'm going to move my gloves up and wiggle a finger. You just tell me which side is wiggling, okay? Looking straight ahead, ready? Good. 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 Very good. Very good. And here, and here. Now cover the opposite eye. Same again. Good. 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 And here, good. And here. And here. And here, very good. Optic nerve. Visual fields is good. Now visual acuity. I'm going to hold up a chart. This is called a Snellen chart. I'm going to point to some various different letters. You just tell me what they are, okay? I'm going to start by covering this eye. Okay, ready? Yep, yep, yep. Well done. And here, and here, and here, and here. And this one, and this one. Very good. Here, 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 here. And this one, and this one. Getting a little harder now. And down here, 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 and here. Well done. Now cover the opposite eye. Okay, same again, start with the top line. And here, and here. Very, very good. And here, and over here. Good. Now down here. Good. Over here. Getting a little harder. Can you see this one? Okay. Good. And over here. What's the lowest line you can see? Okay, try that one. Very, very good. You are doing incredibly well. Now, similar test. This is to check your color perception, okay? Hopefully you can see some letters and numbers in the center there. I'm just going to point at different circles and you tell me what number you see, okay? We'll start with this one. Helps if we have the chart the right way around. We'll start with this one. And over here. And over here. And this one. And this one. That's with both eyes. Okay, now cover this eye. Very, very good. Let's try here. And here. Here. Over here. Over here. Very well done. Okay, now cover this eye. Same thing again. This one, and here. What's this number specifically? Just that one. Okay, and here, and here. Very well done. I must say you're doing terrifically so far. Okay. Color test done. Now, oculomotor nerve. Got a little paddle here. I just want you to keep your head very, very still, okay? Now just with your eyes, follow the paddle wherever it goes, okay? Just moving between the different quadrants of your vision. Keep your head very, very still. Very, very good. All right, now cover this eye. Same again. Looking here and over here. Over here, down here. Over here, up here, here and here and here. Over here. Very, very good. Now cover the opposite eye. Same again, up here, down here, over here. Over here, doing very, very well. Here, 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 here. Good. Extraocular movements, very good. Okay, I'm just going to have a quick look in your eyes with my light, okay? You can move a little closer. Okay. Just looking straight ahead if you could. Okay. Very good. Just look at my ear. Alright, now I'm going to give you some instructions. If you could just follow them to the best of your ability. If you could just look up and look down. If you could look to your left and over to your right. Okay, up and left. Up and down. Sorry, down and left. Down and right. Up and right. Back to the center. Over to your right. Over to your left. Down, up, back to the middle. Very, very good. Just going to check the opposite eye. Just look here at my ear. Okay, now look up. Good, look down. Look over to your left. Look over to your right. Look up and right. Look up and left. Look down and right. Look down and left. Look back to the middle. Very, very good. Doing great so far. Okay. Check the consensual and direct response now. Just have you look at a point over there anywhere. Just pick a spot on the wall or the window or the chart, whatever suits you. I'm just going to swing the flashlight into your eyes, okay? Now, just looking over there. Good. 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 I'm just looking for the direct and the consensual response. This just means that both of your eyes are dilating as they should be, which they are, which is really, really good. Really, really good. Okay. So again, pick a spot over there anywhere. You can look out the window if you want. Okay. Direct response. Direct response looks great. And now the consensual response. Consensual response also looks good. Very good. Okay, let's check the trigeminal nerve. for this, I'm just going to use a cotton pad, okay? Now I'm going to touch you at various points on your face, and you just let me know if it's equal on both sides, okay? If it feels the same on both sides, okay? So we'll start here. Does that feel the same as that? Does this feel the same as this? Good. Up here, does this feel the same as this? Good. And does this feel the same as this? Good. Does this feel the same as this? Does this feel the same as this? Does this feel the same as this? Good. Now let's check how well you can perceive temperature. This is a tuning fork, it's quite cold. I'm just going to touch here, and you tell me if it feels the same on both sides, okay? Okay, and does it feel cold? Good. Same temperature here as here. Good. Same temperature here as here. Good. And the same temperature here as here. Good. Same temperature here as here. Same temperature here as here. Good. Okay, well, I'm just going to check the muscles in your face now, okay? If you could just puff out your cheeks. Good. Now suck them in. Good. Open wide. Now clench your jaw together. Very good. Raise your eyebrows. Now frown. Good. Now squish your eyes together. Open them wide. Good. Clench your jaw again. Just wiggle your nose if you can, like that, like a rabbit. Very good. If you can flare your nostrils, like that. Very, very good. Terrific. We're making great time with this. Tick, 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 tick. Oh, smile. I missed that one. Smile. Good. Great smile. Vestibulocochlear nerve. How's your hearing? Alrighty, I'm just gonna put my gloves next to your ears, okay? I'm gonna rustle one, sometimes both, and I want you just to tell me which side, okay? Looking straight ahead, trying not to look at my gloves if you can. Ready? Good. Good. Very good. Doing well. Awesome. Well done. Yep, that's both. Yep. 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 Okay. Here. Good. And here. Good. And here. Good. Here. Good. Here. Very good. Over here. Good. Here. Great. Here. Well done. Well done. Okay, now same again, but this time I'm going to whisper some letters into your ears, okay? I just want you to repeat them back to me. Okay, very good. Over here first. H, J, R, F, A, B, D, L, I, F, Z, O, R, W. Very good, well done. Over here. T, F, R, G, C, F, E, L, N, L, O, W, Y, Y, X, X, Z. Good. Hearing is terrific. Now let's do a couple of muscle checks and reflex checks, okay? I'm just going to put this at a couple of points over your body. There should be a natural reflex there, okay? Just going to start here. And again. Good, now the backs of your arms or your elbow. Okay, over here. And again. Good, over here. Good. And now your knees. Good. Good, and your feet. Good. Good. Once more on the knees. Yep. 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 Good. Now we're just going to check some of your muscles a little bit further down. Now if you could just move your head to this side, don't let me push it that way, okay? Good. And now if you could just move your head to this side, don't let me push it that way, okay? Good. Now shrug your shoulders up like this, don't let me push them down. Okay, great. Now raise your arms out in front of you and don't let me push them down. Good. Now raise your arms out to the side and don't let me push them down. Good. Okay, now pull your arms in and don't let me push them out. Good. And the same with the front. Pull your arms in and don't let me push them up. Good. Well done. let's try your fingers. If you could just separate them like this. Don't let me push them together, okay? Very good. And over here. Very good. If you could just push against my palm. Very good. Over here. Very good. If you could just raise your leg out and don't let me push that down. Very good. Over here. Very good. Well, I believe that's everything. You've done incredibly well. I hope you have found my conduct to be professional. If you do, if you have enjoyed it and think that it's up to par, please do leave a good review on the way out. There's a little form you can fill in. It really does help, especially get me into the doctor's good books. Thank you very, very much. I really, really hope you come back soon. Just for a checkup, obviously, not because you're ill. Brilliant. Thank you. Okay, I'll see you again soon. Bye-bye. Just relax your shoulders, square them off. Straighten up your back if you could. And if you could just stand up as tall and as straight as you can, okay? Just shoulders down. There we go. Okay. There. Looks to be about 172. Okay. Sure, you won't be surprised to learn that you have not grown. Okay, everybody's least favorite. You could just take a step onto the scales, which should be in front of you. Yep, that's the one. Just there. I'm gonna pop this on. There's a little bar at the top that we need to move over. Please just try and stay as still as possible. There we go. Yeah, okay. I'd be pleased to know that you have not gained any significant weight since your last check, really. Within a pound or two. Blood pressure check. So, I'm just going to put a cuff around your arm and I'm then going to tighten it with a pump, okay? It's going to get quite tight, but it shouldn't hurt, right? Just either arm. Okay, let's just pump this around here. Put the strap on. Okay, and you may feel some slight pressure as I tighten the cuff, but just let me know if it's painful. Okay. About that okay? Good, okay. Okay, good. Perfectly normal and healthy. Take this off. Oh, well, so far, same height, basically the same weight, same blood pressure, which is all in a healthy range. Okay, let's do your temperature. I'm just going to pop this into your ear here, okay? Don't worry, it shouldn't be unpleasant. Okay, ready? I'm just going to pop this here. It just takes a minute to get a reading. There we go. 36.4. That's completely normal. And let's do your heart rate now, okay? I'm going to do this the old-fashioned way. I'm just going to find the pulse in your neck, and I'm going to count how many times your heart beats in a minute. Alright? So it should just be about here, okay. Struggling to find one. Have you considered you may be dead? Just kidding, it's there. Okay, ready? Just try and relax and breathe normally. Okay, good. Say that's about 70, 74. Just going to do the same on your wrists now, okay? Either hand. Okay. You are right-handed, left-handed? Okay. Right, I'm just going to hold here again and do the same thing, okay? So just finding the pulse. That was easier this time. Okay, ready? That was 74 again. Very healthy. It says here that you had a chest infection sometime in late 2019. Still noticing anything? Any fallout from that? No long-lasting effects? Exercise okay? No trouble breathing? Okay. I mean, that's normal. Sometimes when people have quite severe infections in the chest, it can take a couple of years to clear. Some patients, I'm afraid, actually never go back to normal, but it's quite rare. Okay, good. I'm just going to pop the end of this just a little bit down your top. If you could just undo the top button, you don't need to take off the whole shebang, don't worry. The heating is on though. Yep, just that button there. Okay, so I'm going to give you some breathing pattern instructions, okay? If you could just follow the rhythm of 3, 2, 3. So that's 3 seconds on the inhale, 2 seconds holding, and then 3 seconds on the exhale. I am going to change that up as we go, okay? But for now, just... Okay, and down here, if we could do 4 seconds on the inhale, hold it for 3, and then out for 4. Good, and down here. Okay. Yeah, just carry on with the deep breaths. Really try and fill your lungs to their capacity. I don't hear any obstructions. Doesn't seem like there's any phlegm or excess, any debris left from the illness. Okay, if you could just cough, I'm going to go down this side. Big deep breath in, hold it, let out a small cough, just to... should be fine, and then 4 on the exhale, okay? Just a little cough. And another one. Alright, let's do the back now. Okay. Yeah, just gonna start here. Okay. Just carrying on with those big deep breaths in. Hold it for a couple of seconds and then long, slow exhale. Yep. Let's go down here. Okay. Okay, this time if you could just hold your breath for 5-10 seconds. Big deep breath and then hold it. Okay, keep holding. Alright, now exhale. Good, and one last area, just right down at the back. Big deep breath in. Okay, and just hold that. And let it out. Good, no lasting negative effects, it seems. Okay. Alright, I'm just going to do an overall check now. Head, temples, neck, arms, back, legs, alright. This may seem like a lot, but I'm just looking for a few key things first. Alright, so if you could just relax and start by just tipping your head forwards. I'm just going to use the low light for this one, shouldn't blind you. Alright, head forwards. Okay. Yeah. No head injuries, that's great. I don't see any dry skin, also good. No redness on us. I'm going to check your lymph nodes now, that's these bits here. Well, it's 2 of them, you have more than 2. Okay. They don't feel swollen, that's great. I'm going to check the back of your neck. I mean, it's quite tight, but I don't feel any problems besides that. No soreness here. Besides, you know, the soreness that we all get from just getting older. Okay, that's good. Sorry about the light. If you could just look down, just want to look at your top lids. See any redness? That's good. And you suffer from tension headaches, it said on your file. And that tends to be in this region, around your orbital bone to your temple. Not feeling any tension now, are you? Just going to press in lightly here. Alright, just close your eyes for this bit. I'm just going to tap lightly around your eyes. It's going to tap, 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 tap. Tap, 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 tap. I'm going to press down on your sinus region. Okay. If you could just show me your teeth. Get a fresh tongue depressor. Just open wide. And say ah. Just going to get a bit of light in here. Any previous run-ins with tonsillitis? Have you contracted COVID within the past 2 years? No, okay, that's good. I see a couple of, I won't call them white spots, but slightly bright spots towards the back, which is a little concerning, but it doesn't necessarily mean it's tonsillitis. Just say R again. Have you consumed quite a lot of alcohol this week? That could be a contributing factor. I wouldn't say it's a concern, but if your throat starts to feel particularly sore or abnormal, then definitely do come back in. Okay. It's the perfect time for it, sadly, this time of year. Okay. It's fine. If you just raise your arms out to the side, just gonna pat them down. Don't let me push them down. That's fine. If you could just turn your head like this, all the way as far as it'll go. Okay, and if you could just turn it all the way that way. Range of motion in your neck seems fine. Look up to the sky. Right back. Just going to press here gently. If you could just gulp. And again. Okay, and now just look down. Good. Now just neutral position, straight ahead. Okay, if you could hold your arms out in front of you, like this, like Superman. Just gonna try and push them down. Okay. If you could just keep your arms like this and your hands, palms like this, I'm gonna push against them. Don't let me push them back, okay? Okay, now the opposite, just push them forwards. Don't let me push the opposite way. Okay, now arms by your sides, like a penguin. I'm just going to try and push them out, and you guessed it, don't let me. Okay. Good, that's fine. Upper body strength seems perfectly fine. No pain while doing that. A little bit in the shoulder, okay. On which exercise? Pushing out, okay. This arm. Just raise your arm up again if you could, slowly. I'm gonna feel your deltoid. That's this muscle here. Well, you actually have three, but I'm gonna feel the side one. And just lower it down. Any pain while doing that? If you could just put your arm out like this, as if you were a truck driver going along the motorway, and just like to rotate your arm until it's a right angle, and let me know if there's any pain in this area, okay? A little bit at the top. I mean, it could be a rotator cuff issue, it could be an impingement, trapped nerve. I will put a note next to that for a possible physio referral, okay? Yes. Sadly, as a GP, that's, I mean, I know the basics, but you really need a specialist for rotator cuffs, shoulders, impingement, any issues like that. Asterisk, Dr. Roberts / physio referral. Unfortunately, that is private, but it's very reasonable. I think it's about £25 a session. Okay. Incidentally, there's no corresponding pain in that leg, is there? Okay, just sit right back in the chair so that the backs of your knees are pushing up against the side of the chair. I need this little hammer. It's not really a hammer, it's a very lightweight little plastic bell. And I'm just gonna lightly tap at certain points on your leg, and it should go like that. Ready? Okay, and this one. Yep. And behind your foot. And this foot. Good, I'm just going to go here. Ready? Good. Over here. Good, okay. If you could just straighten your leg out, straight as it'll go. And the other one. And put it back. Any pain there? Okay. Could be a posture issue, I don't know, if you've got a corresponding pain in the leg. Again, a physio will be able to assess you much better for that, but this is why we do these exams, to catch things like this before it gets chronic and you can't walk. That was a joke. Okay, so it's going to have a little look in your eyes. We shall use the quite bright light. We'll start off quite bright and then we're going to get a little bit dimmer. It's going to move back slightly. Okay. Now, I would like you to cover this eye, okay? And like you did, look straight ahead here. And in my hand, I have a light. I'm just going to flash it at certain intervals in your peripheral vision. And I just want you to tell me when you see it flash, okay? Don't look at the light. Pretty straightforward. Okay, looking here, covering this eye. Just let me know when you see the flash. Mm-hmm. Okay, and now covering this eye. Same thing again. Okay, just going back to the other eye, keeping your vision straight ahead. I'm gonna hold the light here and I'm gonna progressively move it out of your vision, and I just want you to tell me when it leaves your vision, okay? When you can no longer see it. It just gives me a reasonable idea of your the boundaries of your peripheral, okay? Looking here. Start off nice and easy. Great. Just tell me when you no longer see the light. Good. 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 Start here, move outwards. Good. Starting here, moving outwards. Starting here, moving outwards. Good. And cover the opposite eye, okay? Just keeping your head very still, okay? Keeping your head still. Okay. Just letting me know when it disappears. Okay, sticking with the light theme. It's okay, you can uncover your eye and blink for a second. Yep, okay, good. Okay, either focusing on my ear or a point on the wall behind me, either the x-ray or any of the lovely background. I am going to cover this eye, and then I am going to shine light into your eye, okay? And all you have to do is just look straight forward. Pretty easy, okay? Ready? Sure you've done this test before? It's known as the swinging flashlight test, and I'm checking to see that your pupils dilate when light is shone directly into them. And now I'm going to part the middle, just create a dividing line down your face, and now I'm going to check that the opposite eye is dilating. This is called the consensual response. This is direct, and this is consensual. Good, and now we're going to do the same with the opposite eye, okay? Okay, so just covering this eye, either looking at my ear or a point on the wall behind me, I'm just going to briefly shine the light into your eye to check that the direct response is functional, which it appears to be. Very good. I'm really sorry for blinding you. It is sadly necessary. And now we're going to do the same again. Divide and check the consensual response, which, surprise, surprise, is working perfectly. Okay, good. Feel free to blink a few times. Yes, it can be a little unpleasant. I apologise. This light isn't quite so bright, however I do have to come in quite close, so there is that. Just going to briefly have a look in the back of your eyes now, okay? We'll start with this one since we were already working on that one, okay? Alright. I will be coming pretty close, but only for a very brief period. Alright, just finding the vein. There it is. Okay. Just looking at my ear. And looking upwards to the sky. Now looking down. Looking to your right. Looking to your left. Looking diagonally up and right. Diagonally up and left. Down and left. Let's go down and right. Back to the center. I'm just looking at my ear, okay? Good. Blink. I mean, it's not mandatory, but it does help. Better? Okay. So let's just cover this eye. Right, do the same again. Okay. Just looking at my ear. Okay, if you could look up. And down. Look to your left. And to your right. Up and left. Up and right. Down and left. Down and right. Back to the center. Good. I need to blink a few times after that. That seems perfect. Okay. Just need to record a few things. How are you finding the relaxed pace and lower light evening medical session? experience. We really need a name for it. Good. Would you be willing to take a questionnaire at the end, give some feedback? It's really just about improving the patient experience while giving our staff a break. We tend to work at 1,000,000 miles an hour, so any chance we can get to just kind of breathe is great. Alright, let's do the slightly funky one. I need this with this, and the brain pads. Yep, you heard me correctly, I did say brain pads. It's quite simple. So in your previous insomnia treatment, we looked at several courses, and obviously we had quite a lot of success with the ASMR treatments. Yeah. Yes. So today we are going to continue down that path. I've got some pads, don't worry, they're sanitized, and I'm going to place these onto each side of your temple. They're very, very comfortable, don't worry, they're basically just plasters. Yep, okay. Don't worry, they peel off easily, they won't rip your hair out. Okay. Just see if they're coming through on the machine. Right, let's do the Autonomous Sensory Meridian Response Program 1. That essentially means while we monitor your brainwaves for perceptibility, susceptibility to different stimuli, I'm going to be reading you some words, okay? These are words that during the ASMR tests indicated quite a strong result, so you're susceptible to these particular words, it would seem. And we're just going to measure them on the computer via the little pads. Right, let's run the program. You're more than welcome to close your eyes if you wish, okay? I'm just going to be going ear to ear and repeating some words, phrases. I'll probably throw a few random ones in there. Please just try and relax. The more comfortable you are, the more accurate the response will be, okay? Ready? Okay. We'll start with some inaudibles using the sk sound. Sk, 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 sk is a really popular trigger for some people. Sk sounds, sk sounds. That extends to words using the sk sounds like spirit, 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 sk sounds. Snips, whisks. It's the SKs, the snips and whisks. How are the SKs doing it for you? Are they triggering your autonomous sensory response? That's the sk sound. Very good. Well done. DC response. Let's try and click. Good, lower lashes. Let's try clip. Good. This obviously depends quite a lot on your pronunciation and your accent. Good. I am from North England, so I say good. Good. Let's try whisk. Lower lashes. Lower lashes alliteration tends to be quite successful in triggering ASMR alliteration. Words beginning with the same letter. Lower lashes loudly. Very good. Lower lashes alliteration. Lower lashes. associated with sleep, calm, relax, 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 sleep, calm, breathe, relax, 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 calm, 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 calm. Good, okay. Let's just have a look at that. Let's save that. Good, alright, let's take these off. Not too bad, was it? Good, okay. I mean, it seems irregular. It seems irregular, but if you don't embrace new treatments, new methodologies, then medicine becomes stale and outdated. We are pretty good at treating most diseases. Broken bones are pretty good with that kind of thing, but surprisingly, insomnia, mental issues, anxiety, that kind of thing, if there are any treatments that we can look at that might be some kind of breakthrough or way forwards or offer something positive, then we absolutely would be doing ourselves a disservice if we did not pursue them. So this seems to have promising results. It's pretty remarkable. Something that can cancel out one's anxiety, help you sleep, and you don't even need a pill. So it's kind of a cognitive behavioral therapy, really, but anyway, good. It's good to have some actual graphical data there. Okay, we've done most of the overall checks. I just want to have a brief look in your ears. Okay. You can, of course, book in for a full ear examination and hearing check, but this is just a relatively rudimentary check just to make sure there's no glaring issues, no infections. Do you struggle with hearing? Any history of deafness in the family? Any relatives wear a hearing aid? Okay. Don't see any excessive wax build-up, which is good. Your ears look well maintained, which is also good. Don't see any blockages or congestion, also good. Okay. All good in that side. If you could just turn your head that way slightly, helps me to see what I'm doing a little bit better. Okay. Pretty much the same story on this side. No congestion, or minimal congestion. There's obviously a little bit of wax, but that's normal, healthy. Too much is a bad thing, but it seems to be within a completely normal range. No sign of infection. No swelling. Any tenderness? Nope. Can see you've got a piercing there, or a piercing hole. Yeah, I also have my ears pierced. We were all young and adventurous once. It's not very adventurous, is it really? Yep. Seems to feel absolutely fine. Okay, I'm just gonna clear that bit of wax on the part of your anti-helix. Just kind of lodged in there. It's not serious, but I mean, while we're here, might as well. Just keep looking that way. Actually, just break that down with a little bit of spray. Good. Perfectly harmless. It just helps to break up the hard earwax and allow me to remove it better. Good. There we go. You can do this with a syringe, but it's more pleasant this way. I tend to use a syringe for really deep wax that's been pushed into the ear canal, which you get from using Q-tips, but clearly you don't, which is good. Okay. I'm going to do the same on the other side. A little bit of spray. And here. Let's get a new tool, obviously. Want to always be hygienic. Okay, yeah, same area. Just lightly chipping away at that until it breaks free, which it isn't doing. That all sounds good. We're just going to do the same but from the back now. Okay, so if you just swivel in the chair, I'm going to again just pop this down the back of your shirt. I apologise for the slight coolness of the end. Feel okay? Alright, good. And just normal, slow breathing, okay? Big deep breath in. Really expand your lungs and then exhale. Good. And same again down here. Really expanding your lungs. Very good. Exhale. Okay, this time we're going to hold it, right? Same as last time. Big deep breath in and hold it there. That's very good, just hold it. Keep holding it. Okay, you can relax. Good. Just gonna put it a little bit further down. Same again. Really big deep breath in, and if you can, just hold it. Keep holding it and exhale. Good. This time we're gonna cough again. So big deep breath in. And just a little, just as if you were clearing your throat. Good. And again, one more time down here. And a little cough. Okay. Sounds absolutely fine. Lungs sound nice and clear. Just going to make a little note of that. Good, alright. So, no obstructions. Assuming that you don't smoke. You have very clear sounding lungs if you do. Alright. Good. Now I'm just going to check your heart rate, okay? And I'm going to do this the old-fashioned way, which means I'm just going to feel along your neck here. Once I've got your pulse, I'm going to time 30 seconds, and that should give me a rough BPM. And we're going to do it in a couple of places here and here as well, okay? Now if you could just try and relax while we're doing this, because any excess stress can speed up your heart rate and give a false reading. So just try and breathe nice and slow and There's your pulse. Alright, ready? Good, doing very well. That's very good. Just keep breathing normally. Nice and relaxed. Good, okay. I'm just going to do one more reading on the neck, okay? Just helps to have a few. Alright. And 3, 2, 1. Keeping that breathing nice and slow and controlled, you're doing very well. Okay, great. It's a very good resting heart rate. It's 68 beats per minute. Just going to clarify and make sure that that's 100% accurate. If you could just put your wrists forward. I'm going to find your pulse and just do it again. And then I'll take an average between all three, okay? Just gives us the most accurate reading. There it is. Don't worry, you're not a vampire. Okay. And same again, just breathing normally and trying to stay calm and relaxed. Do you exercise regularly? Well, we all wish we could exercise more regularly than we do, but that's a pretty good resting heart rate. Okay, about 68, 69, 70 odd. That's very good. Doing very well so far. Alrighty, I'm just going to check your blood pressure now, okay? So if you could just put out your arm and roll up your sleeve. I'm going to put this little strap around it, okay? I'm going to then pump it up. It's going to tighten, hopefully not to the point that it's uncomfortable, and then it's going to take a reading. But it should be quite tight, but again, not to the point that it's painful, okay? Alrighty, pick an arm, either arm, doesn't really matter. Okay. Okay. Just going to strap this here. Ready? Let me know if at any point it gets too tight, okay? About that? Okay, good. Just one moment while it takes a reading. Okay, good. 130/80, which is slightly higher than previously, but I would still say, in a normal range. Any higher, though, maybe look at reasons why that might be, but I've seen much worse than that. It's just in comparison to your other readings, it's slightly raised, okay? Alright, let's quickly just check your temperature, if you don't mind. Again, we're going to do this in the relatively old-fashioned way. I've got a thermometer, it's going to go under your tongue, alright? So if you could just open your mouth, lift up your tongue. I'm just going to place this here. It shouldn't take long. Yeah, 36.2, very normal. Lastly, I think we can just have a little look at the injury area. Anytime people have a head-related injury, it's always best to check over the scalp. If you could just pop your head forward. Okay, I'm just going to be pressing very lightly and passing your hair slightly. If you can just let me know any discomfort, any pain or sharp pain as well, especially. I would expect some sort of dull kind of pain around this area. Did you just pop your head forwards? No prior injuries there, are there? So this is all. I'll post that. Okay. Alright, very good. I'm just going to be pressing slightly around the orbital bone, just on this side. Again, you let me know if there's any severe discomfort. Sorry if it's a little tender, although that is to be expected. No pain around here. And this. Slightly swollen on that side as well, compared with the other side. Yeah, I can see that. And if I press here, on a scale of 1 to 10, sort of 10 being unbearable agony, obviously 1 being barely feel it, what's that about? Okay, so yeah, about a 4, so it's reasonably tender then. Oftentimes when we hurt this part of our cranium, vision can be affected just ever so slightly. I've got a light here, I'm just going to be shining it around your pupil, so I do apologise. You can just look straight forward. Yeah, there's quite a lot of redness there actually. Sort of the skin's pulling down a little bit, almost a kind of drooping on the injured side, yeah. Dilation in your eye seems normal. It's just inflammation around the cornea, and I mean, most of your pupil is quite inflamed as well. Doing very good. Alright, just quickly focus here. Don't move your head. Just follow with your eyes. Remember, keep your head still. Good. Okay, do me a favor. If you could just cover the non-affected side. Okay, now just make a little dividing line in the center. Okay. Alright, okay. I think lastly we should address that wound. It's important to take good care of it, make sure that it doesn't get infected, so I think we'll just go in the area, clean all around here, make sure there's no gunk in it, and then I'll dress it, put a little dressing on it, make sure it's nice and clean and heals properly, okay? Good. Just put your head down if you can. I'm going to be using some antiseptic cream. This might sting a little bit, but I'm just going to dab around here. Dab very gently and just make sure that The area is looking a lot better. Good. Head down. Yeah, once this is dressed, it should look much better, and I'd imagine this would heal up in about 2 weeks. We'll give you some creams and some special wipes for it. It's important that you are gentle, but make sure to clean it out every day or every couple of days, depending. If it's looking a little bit sore, maybe just go extra gently. Definitely no hard scrubbing. Okay. It's looking better. Okay, good. Doing very well. Yeah, I'm just using a strong numbing and antiseptic cream. Cleans it out, cools it down if it's looking a bit red. Hopefully once the stinging subsides, it'll actually kind of numb the area. Should help it stop bothering you as much. Good, you're doing very well. Good, well done. It's looking better. Good, yes. Yeah, make sure to it's best to change it in the morning. So after you've slept on it for a night, obviously that'll probably be when it's head's against the pillow, so it tends to disturb it slightly. So yeah, first thing in the morning, get up, give it a good clean, reapply the dressing that we'll give you, and then as it starts to heal up, you can cut back from every morning to every other morning, and then by the 2-week period it should be looking a lot better. Yeah, we'll give you some instructions along with the prescriptive creams, but yeah, just stick with that, you'll be absolutely fine, I'm sure. If it is looking significantly worse, so really red, anything coming out of it, God forbid, then do come back in at once, because that probably means it's infected. But if you follow this procedure and try not to disturb it too much, then odds of it getting infected are pretty slim. There we go. That's great. Alright. Just gonna put a bandage. Well, it's more like a small plaster, but a covering on that. Yeah, this will be the one that you change every day. Okay, head forwards. Just gonna press that in there. Okay, a little bit of pressure here. Head down again. Just going to press on it. Does that feel nice and even? It's nice and stuck down. Okay, good. Okay. Give you the A45 cream for that. Prescription side. Probably only need a 15 milligram tube, maybe 10 even. Yeah, you can take painkillers, ibuprofen, paracetamol, as you have been doing. I wouldn't say anything stronger than that. I also would try and limit it to about 500 milligrams each, maybe up to 800, split between the day if it's really bad, but to be honest, it shouldn't be causing you a load of grief. It'll be sorest for the first few days, obviously, but after that you should see some fast improvement. Okay. So give this to the lady at reception, and she will hopefully sort you out with some creams and some antiseptic wash, and some pads just to help clean that every day. Good. Also, I will send over a copy of your updated medical records to your GP, so that's good. It's nice to keep them up to date, obviously. Besides that, is there anything else I can help you with? Great, fantastic. Well, again, I am sorry for the wait, but that should heal up absolutely fine. Shouldn't leave any marks. Good, look after it, keep it clean, and I shall hopefully not see you back here soon. Okay, brilliant. Thank you. Bye-bye.